Good evening, everyone. First, let's see some case scenarios. After that, we'll get into the topic for the day. In case scenario 1, we have a 16-year young boy presenting to the emergency department with complaints of nausea, vomiting, diarrhea for the past 2 days. He also complains of abdominal pain, which was initially started at the periumbilical region and it traveled to the right lower quadrant. He was tachycardic, febrile, and on examination, there was diffusely tender abdomen with rebound tenderness. So in this case, see nowadays the thing is like the examination consists of case scenarios. They are asking about, they are giving a case scenario. They will ask you to find out, arrive at the diagnosis, or they may ask at a certain investigations that are specific for that particular condition. So in this way, if at all, since there are so many questions, if such kind of questions are more in your question paper, I actually advise you to just underline important things that are there in the question. Like in this case, the 16-year young boy, he is a teenager presenting to emergency department with complaints of nausea, vomiting, diarrhea with acute abdominal pain. So if at all you take these things, it seems like he is a case of a teenager presenting with acute abdominal pain for the past 2 days. And the pain started in the periumbilical region and it was radiating towards the right lower quadrant of the abdomen. He was tachycardic. So if at all they ask the question is like what is the diagnosis? Easily you can just deduce with little bit of knowledge saying that this is a case of acute appendicitis. We have one more case scenario. Same again, a 18-year-old teenage girl presenting to emergency with complaints of abdominal pain, fever, nausea and vomiting for the past 2 days. She also had history of non-bloody diarrhea and the pain was not subsiding after defecation. Even after defecation, her abdominal pain was not improving and the pain used to be localized around the right lower quadrant of her abdomen and it was severe in nature. She was febrile and on palpation there was pain noticed on the right lower quadrant of her abdomen. They had performed some laboratory investigations showing it was suggestive of elevated leukocyte count. So again, this is a lengthy case. You have to just mark the important things. She is a teenager again at emergency department, patient presenting to emergency with acute abdominal symptoms, and she also has severe pain in the right lower quadrant with elevated temperature and elevated leukocyte count. Again, as you see previously, this is also a case of acute appendicitis. So in this case, they are asking which of the following is most likely associated with this patient condition. They are not asking you about the diagnosis, but they are asking which of these situations options that are given are non-cageating granulomas, ectopic gastric tissue, lymphoid hyperplasia, mesenteric adenitis and target sign. See, I am also an average student. When I started, I used to start with whenever I start a topic, I used to solve my previous year question papers or question banks. If at all you are solving like that, you will be making some committing some certain silly mistakes. You will be aware of what is the knowledge that you are having. So if at all you solve previous MCQs first, followed by go through the theory part properly, then come back to the MCQs and solve again. If at all you are reading theory and solving the questions, then it will be very easy. You think like you know everything, but as the what do you say syllabus keeps on piling up, it will be difficult for you to revise. It will be difficult for you to know about the topics properly. So in this case, they are asking what are the most likely associated condition with this patient. So in a patient with acute appendicitis, we are seeing they are asking for non-cageating granulomas. Always go learn a little bit about the options also provided, because most of the situations, in most of the cases, even in previous MCQs, in the coming MCQs also, there will be some important topics. They will be revolving about that particular topic only. So if at all in the options as they given non-cageating granulomas, where you can see in some certain chronic conditions like Crohn's disease. So you are just brushing off Crohn's disease that it is seen in non-cageating granulomas. And ectopic gastric tissue should always ring a bell about Meckel's diverticulum. So that is also a wrong answer. And mesenteric adenitis is usually seen in the first decade of life. and these kind of patients will have Yersinia infection which is a gram-negative bacterial infection. So I don't know, in the option they have given target sign on ultrasound. I don't know anything about target sign. So what has to be done? So if at all when you study about, have a little bit understanding about the options, you will know that target sign, if at all you find out, it will be seen in intussusception. So you are also covering a part about intussusception, Crohn's disease, Meckel's diverticulum, other parts. So answer for this question is lymphoid hyperplasia because of the reaction of the infection. So we are discussing about acute appendicitis. I am myself Dr. Chandrasekhar Reddy. Coming to what is acute appendicitis? Just simple, it is inflammation of the appendix. Acute appendicitis is a medical emergency that occurs when the appendix becomes inflamed, swollen and diseased. There are certain MCQs that are asked previously. These are all simple questions, but they used to ask in the previous years, like long back, 10 years back. So we see, what is the most common general surgery emergency condition noticed worldwide? Is it a perforation of the abdomen or is it acute appendicitis? The most common general surgery emergency condition that is seen in the worldwide is acute appendicitis. Most common general surgery complication that is noticed in pregnancy, again, which of the options are appendicitis, Meckel's diverticulum, UTI or gastritis? See, this is a simple question, but when you find appendicitis and Meckel's diverticulum, there are chances that you may commit mistake. Again, the most common surgery complication in pregnancy is appendicitis, and most common organism causing acute appendicitis is E. coli or Bacteroides or Klebsiella. The options are like this. You know, because you will be coming across these organisms most often, if not. So the most common organism causing acute appendicitis is Bacteroides. It's not E. coli. Remember that. Coming to the surgical anatomy, excuse me. Coming to the surgical anatomy, the appendix develops from the midgut, which is one of the reason why the patients with acute appendicitis will have pain in the periumbilical region, which is the first sign. The reason why the acute appendicitis presents as a periumbilical region is because the appendix develops from the midgut. This is one of the MCQ. So coming to the other general features, like length of the appendix measures about 2 to 10 centimeters. The volume is less than 0.5 centimeter cube. And one more thing, what you need to understand and remember is the position of the appendix can be different. It can be retrocecal, pre-ileal, post-ileal, or it can be pelvic. But the location of the base of the appendix will always be constant. This is also one of the MCQ. Okay, the location of the base of the appendix is always constant. Where you can see the base of the appendix at the junction of the tinea coli. Tinea coli is, as you know, is a longitudinal muscles of the large gut. Okay. Previously, they have asked some similar questions like which is the most common position of the appendix, which is the least common position, which is a dangerous position. We'll come to those topics in the subsequent slides. Coming to the position of the appendix, the most common position of the appendix, it's almost 60 to 65% is retrocecal, that is behind the cecum. This is the most commonly seen position, followed by pelvic appendix that constitute around 30%. And there are other positions of the appendix like subcecal, pre-ileal and post-ileal. So most common is retrocecal, least common is post-ileal. This is also one of the questions. Just please remember that post-ileal is one of the the least commonly noticed position of the appendix. And which is the most dangerous position of the appendix? It is pelvic appendix. Why pelvic appendix is dangerous? See, the patients with pelvic appendix, they will be having symptoms, but the abdominal symptoms are not that prominent as you see in retrocecal, subileal, post-ileal, because it is situated in the pelvis. And one more thing, whenever such kind of patients are presented, the clinicians usually suspect about pelvic pathology rather than abdominal pathology. So there is delay in diagnosis, which eventually leads to chances of rupture of the appendix. So what is the blood supply of appendix? Appendix is supplied by appendicular artery, which is an end artery. What is an end artery? End artery is one artery which supplies some organ or tissue without any contributors. Which is the other, can you give any other example for end artery? Retinal artery. Is splenic artery is a end artery? Just find it, okay. Appendicular artery is a branch of ileocholic artery. Ileocholic artery again is a branch of superior mesenteric artery. Superior mesenteric artery is the artery of midgut. So what about artery of foregut and hindgut? These are all important questions and you have to know about it. Foregut, celiac artery, and hindgut, it's inferior mesenteric artery. The venous supply follows the arterial supply. The venous supply is through appendicular vein, which drains to ileocholic vein. Lymphatics follows the arterial and venous supply. The lymphatic fluid is mainly drained by ileocholic lymph nodes. There is this entity called accessory appendicular artery, which is also known as artery of Sheshachalam. They can ask, see, the exam is about elimination. There, when 60,000 people are compared, see, 2 to 3 lakhs people are competing for 60,000 odd seats. Obviously, if at all you know little bit more than your friend or someone, your competitor, I think it's better that you have a little bit of hedge. Okay, so this artery of Sheshachalam is a branch of posterior cecal artery. Artery of Sheshachalam, which is a accessory appendicular artery, is a branch of posterior cecal artery, which in turn is a branch of ileocholic artery. So how does appendicitis progress? Like, what is the etiopathogenesis? The causes for acute appendicitis can be because of luminal obstruction or non-luminal obstruction. What is luminal obstruction? Whenever the lumen of the obstruction is obstructed because of fecolith, which is most commonly seen, some worms like Ascaris lumbricoides, food particles, some seeds, and tumors. These are all seen in adult patients like teenagers. In children, usually the etiopathogenesis for development of acute appendicitis is because of obstructive reasons. That is lymphoid hyperplasia that obstructs the appendix, causing to the symptoms and signs. So what happens is, whenever there is luminal obstruction, there is increased pressure in the lumen that causes first impairment of the lymphatics, followed by the venous supply, and finally the arterial supply. Once the arterial supply is blocked, it can lead to perforation if the diagnosis is delayed. So again, one more MCQ, what is the most common site of perforation? Where you see, if there can be a question about just the most common site of perforation. The most common site of perforation of appendix is just distal to the obstruction on the anti-mesenteric border towards the tip. Please always, whenever you are reading the question, answers or options, just make sure that you are reading, don't make mistakes of mesenteric, anti-mesenteric, right, left, other things, okay. The most common site of perforation is just distal to the obstruction on the anti-mesenteric border towards the tip, okay. So, coming to the clinical features, it's not a theory exam. If at all it is a theory exam, you should know in detail. So right now, if at all we are considering about symptoms and signs of the acute appendicitis, which is the most characteristic symptom and characteristic sign that you see in acute appendicitis. Is it fever? Is it periumbilical pain? Or pain at the right iliac fossa? Anorexia. We'll see. See, acute appendicitis is mostly seen in teenagers. In the case scenario 1, he was 14 years, and case scenario 2, she was 18 years, okay. And it is usually seen in the second decade, that is teenagers. Not that common in infants and elderly people. And the most significant symptom that is noticed in acute appendicitis is migratory pain. What is migratory pain? It is also called as shifting pain, because the pain usually starts around the periumbilical region, which is the earliest sign. This is also very important. Which is the first sign that is noticed in acute appendicitis? Migratory pain that starts around the periumbilical region, which migrates from umbilicus to the right iliac fossa and settles there. Why there is pain in the periumbilical region when the pathology is at right iliac fossa? Because of the irritation. The collected fluids at the right iliac fossa irritates the visceral peritoneum. Visceral peritoneum is pain sensitive, hence there will be pain at the periumbilical region. Other symptoms important symptoms are anorexia, nausea and vomiting. Fever is also there, but it is sometimes it is actually a late symptom. Other signs are tenderness is noticed at the right iliac fossa. You should know about the quadrants of the abdomen, 9 quadrants, and the tenderness is noticed at the right iliac fossa, especially at the McBurney's point. McBurney's point roughly corresponds to the base of the abdomen, base of the appendix. That is, the McBurney's point is a line. When you draw a line from umbilicus to the anterior superior iliac spine, divided into a medial 2/3, lateral 1/3, that junction is McBurney's point. That roughly corresponds to the base of the appendix. So, patient will have tenderness and palpation at the right iliac fossa. There will be rebound tenderness. There will be elevated temperature. The other not so routinely seen, but important signs, at least for the examination point of view, are you should know about, there are certain named signs. These signs you should know, because just like as in thyrotoxicosis, you will have like eye features, the Van Greffes and the Darling-Impel sign. You should also know these signs. Okay. So tell me, which is the most significant sign that is seen in acute appendicitis? Is it Aaron sign, Rousing sign, Dumfries sign, and Tenor sign? So these are all confusing, and you should know, because they have asked multiple times about these questions. Okay, please know the names and know how the tests are elicited. Pointing sign is one of the signs that is seen. The patient points at the maximum tenderness. Rousing sign is the most significant sign that is noticed in acute appendicitis. What is rousing sign and how it is elicited? During the palpation, you start palpating from the left iliac fossa. Patient will have pain in the right iliac fossa. It is because of the displacement of the fluids on the left side, or it could be because of irritation of the peritoneum. So this is a rousing sign. What is the rousing operation and rousing syndrome? Rousing operation is seen in adult polycystic kidney disease, and rousing syndrome is seen in some, again related to renals or Shu kidney. So these are all confusing terms. So whenever you come across these terms, just make a note of them. Okay. The other signs are sauce sign. Sauce sign is also called as a Coppe sauce test. What you will do, you will ask the patient for whenever there is a hyperextension of the right hip joint. Make sure that whenever the sentence comes like this, the examiner may be confusing you with saying that hyperextension of the left hip joint causes pain in the right iliac fossa. These are all silly mistakes, and you should not do that. So make sure that you read the options properly. So hyperextension of the right hip joint causes pain in the right iliac fossa. Right hip, right iliac fossa. It is usually seen in the retrocecal appendix. Okay. Now, what is obturator sign? Obturator sign is again one of the signs that is seen in pelvic appendix usually. Whenever there is flexion and internal rotation of the right hip joint, patient winces with pain in the right iliac fossa. Okay, and there are some other non-specific signs. Clinically they may not be important, but they are important for the examination point of view. Dumfries sign. Dumfries sign is pain while coughing. Whenever there is patient cough, he or she will have pain in the right iliac fossa. And Aaron sign. Aaron sign is when you palpate epigastrium, there will be pain in the right iliac fossa. Okay, and there was one question about Tenon sign. That is, when you pull right testis, there will be pain in the right iliac fossa. MCQs can be asked about names and other things that are mentioned so far. Coming to the laboratory investigations, the significant blood investigation that is abnormal in the acute appendicitis is leukocytosis. There will be elevated WBC counts, especially leukocytes. There is shift of leukocytes towards the left. That is, there is increased immature cells and predominantly more of neutrophils. So how are you going to diagnose? Just remember, in acute appendicitis, especially in adults, the diagnosis is always mostly purely clinical. Okay, this can be complemented by laboratory investigations and imaging studies. So there can be a question, just like if at all the children is presenting to you with complaints of right iliac fossa, so they may ask, what is the investigation of choice? Patient may have all the features suggestive of acute appendicitis. They may be asking you, what is the investigation of choice in this child? Since it is a child, always remember, investigation of choice in children is ultrasound. Okay, and what is the investigation of choice in adults? The investigation of choice in adults is CCT. Okay, these are all the questions that have been asked. And what is the gold standard investigation that is for the acute appendicitis diagnosis is CCT. Again, if at all a pregnant lady is to be diagnosed as a case of acute appendicitis, what is the gold standard investigation? Is it ultrasound, MRI, or CCT? The gold standard is MRI. Okay.